Rhoda Owens is, well, she's got her PhD, she's got her RN, she's the assistant professor at the College of Nursing and Professional Disciplines at the University of North Dakota, which, if you forget where she works, you're going to see it in the background of the interview we're about to do. But most importantly, she's earned the right to be called Dr. Owens. Let's bring her in. Dr. Owens, good to have you coming down the road with us.
Thank you for having me today.
I come from a UND family, so thank you. It's, coming from the southern end of the valley, we don't hear as much about UND as I think we should. So it's good to see you come on. Want to talk to you a little bit about what's going on in nursing. A little bit earlier, we had a chance to visit with North Dakota's workforce, one of the directors that works there. And what we heard was that in the industry that you're working in, trying to create the next great workforce, we're really short right now. What are you seeing?
Yes, we do continue to have a nursing shortage throughout the state. We have for some time. The University of North Dakota College of Nursing Professional Disciplines, like many other programs in the state, have been focusing on increasing the number of nursing program graduates. I know, speaking from the University of North Dakota's view, or our initiatives, is we have increased enrollment in pretty much all our programs. That includes the RN to BSN programs, so that's nurses that have their license already and they decide they want to go back and get their bachelor's degree. Also, our pre-licensure nursing program, which are students that are pursuing that first nursing degree towards a bachelor's of science in nursing. We've also increased that enrollment. Also, there's such a need for nurse practitioners throughout the state. We particularly have two programs that are active right now. Our family nurse practitioner program, we have increased applicants and acceptance and graduates on that program. And also our psych mental health nurse practitioners, which is a real need for behavioral health. We have such a shortage of providers, and nurse practitioners can really fill that role and help with that. And then, of course, our nurse anesthetist program, our PhD program, just trying to prepare nurses to be educators. And even, we have a shortage of nursing faculty also, throughout the state.
I want to make sure I understand. Are we talking about the amount of students you can bring in? When you say increased enrollment, are you talking about the availability for the education, or are we talking about the number of students that have come in? Are there more young men and women that want to be nurses, nurse practitioners?
Well, our enrollment was good as far as wanting to be nurses and nurse practitioners. Especially nurse practitioners, we've really had an increase in inquiring on our program. And most of those come from the Midwest. They don't all come from North Dakota, but, in the Midwest area. But, the enrollment, I think students are still interested in pursuing a nursing degree. I know it has varied some, throughout the state, but, our applicant pool continues to be very strong. And we've actually tried to have increased the overall enrollment in our programs because we do want to increase the supply of nurses in our area.
So as the father of a nurse practitioner and a husband of an RN, I know exactly what you're talking about, but at some point they get burnt out. My daughter, who works in a clinical setting, has seen a number of doctors retire because that's the age that we're in, and her workload has increased drastically. Now, I'm not saying she's whining. I'm not saying she can't do a good job, but at some point you burn out. I mean, are you hearing that from the industry at all?
Yes, that's an interesting point that you bring up. I participated actually in the University of North Dakota, participated in a state nursing workforce study with the North Dakota Center for Nursing. Dr. Patricia Moulton is the director of that organization, and we partnered together to conduct a research study across the state. This was actually 2019 to 2020. So right at the beginning of COVID, and then as the COVID pandemic started, we collected some data as far as Why are nurses staying in the state? Why are they leaving? And so we focused in on practicing nurses all over the state, also on nursing students in their last semester of their coursework. And we completed focus groups. We really wanted to gather information right from those students and also the nurses that are out working. And also we did an online survey, and we had over 700 nurses participate in the focus groups and online survey, and roughly about 300 to 400 students. And what we found out, and just trying to find out what is going on in North Dakota, we know what the research says, but we did find out that number one, competitive pay and benefits was something that they're having, that they want to have that will really attract them to their employer and also the state. So that's anywhere from tuition reimbursement, helping with professional development, helping get them find childcare. Just finding good childcare has limited some of their ability to work full time, and that type of thing. Offering flexible scheduling. Something else they're looking for is working in a positive, healthy environment. And we know there's a lot of stress now. There was before COVID, and even more now. And yes, burnout. So we did measure burnout, and burnout was one of the factors that would encourage them to leave North Dakota or seek another place of employment that they thought would be better. So ways, we asked them, well, how can we help with your burnout, or can we help with that healthy workplace environment? Is that just help us feel appreciated and supported. Let us work it within our scope of practice. Let us have a say in the changes or the processes of doing care. Managers and leaders are so important to nurses that they just help provide that support to them, and that's not always going on. And it needs to be a whole system approach. So the whole healthcare organization, has to support them along with their interprofessional team members. They really value those collaborative relationships. And also some other factors that can help with burnout too is to meet their career goals, also help them with their personal goals and reasons for wanting to be a nurse, support that.
So if you did, Dr. Owens, that type of research, and
Mm-hmm.
you dug into it, did you ask the industry itself? I mean, they're so desperate for nurses. They're so desperate for, what people like my daughter can do. And I'm hoping I have her title right, because she's one of the individuals that went on to beyond her bachelor's degree to be able to prescribe medicine. If they need people like her, why don't they pay more? Why doesn't there seems to be such a separation between an RN working the floor that you desperately need and the physician? I mean, has the industry said why they don't pay more?
No, they don't. They just they say what we pay what we can, but we've been trying to spread the results of our research. As we actually have a pilot study. Our next steps of this research was to develop a North Dakota nursing culture of excellence program, and so right now we're presently working with 3 healthcare facilities throughout the state. And we've been working with their administration, and just, we've got a whole set of standards and criteria that we're working with these facilities. And just, and we discussed that it's based on our research specific to North Dakota. And one of those is, offering competitive pay and benefits. And we also are providing tools for them to do a real assessment to make sure that they are providing those pay and benefits.
Yeah.
But that's a good question, considering a lot of our nurses in our study, and we have heard as we have implemented this healthy nursing workforce program, is that nurses are upset about the high pay that the contract nurses are getting. And so some of them are actually leaving as employees of the actual healthcare systems and going to work as a contract nurse.
Yeah.
And coming back and working for their facility.
Yeah.
So it's kind of a cycle, and Yeah, I guess that's what we need to try and work out as the solutions for that.
Well, and we talk about a cycle, but it hasn't turned around for quite a while. I mean, my wife was an administrator when it comes to nurses for a long time, and she was always short. She was
Yeah.
always short. So keep doing what you're doing, Dr. Owens, because it's desperately needed. And when you get a chance to visit with the providers themselves, tell them to open up their checkbook. Tell them the top end doesn't need to get paid what they get paid. They can sprinkle that on down. So,
Yeah, nurses, they just need to be provided and valued. Nurses, as we know, we work in so many different care settings and at the bedside, especially in acute care. And there's so many areas in acute care. Like you've got critical access hospitals in the rural areas, you've got them in the larger cities. But nurses need to be valued because we work with the patients 24/7. And a hospital would not function without the nursing staff. And so, hopefully, industry will continue to see that and, try to value our nursing staff more and more and just, whether it's pay and benefits, but, it's so much more than that also, which we find out in our study. Just providing that healthy workplace environment and helping nursing staff focus on self-care. One part that has really been in the literature a lot in the media is resilience. So that's an area too where I really think that healthcare facilities need to focus on resiliency training for nurses just to help them with their well-being and mental health concerns, which we have a lot of it now in the nursing staff. And that is part of the burnout that's happening is because, they're not able to care for themselves. They're not able to cope with everything going on in the workplace environment.
Yeah. Well, you take all of that and then you add a pandemic to it at the end when the problem was already there. And Dr. Owens, thank you. I appreciate you coming on.